Hello, good evening, ladies and gentlemen. Welcome to ISF College of Pharmacy Dialogue Series. As you know that ISF College of Pharmacy Moga Punjab is conducting ISF Dialogue Series under the aegis of Internal Quality Assurance Cell, into which eminent pharmaceutical scientists from international as well as national level are coming one by one. Every day we are uploading a video of this knowledge series. So, ladies and gentlemen, today I want to introduce today's speaker, Dr. Dharmendra Ahuja. Sir, welcome you, sir. Dr. Dharmendra Ahuja, sir, is M.Pharm PhD in pharmacology. He has qualified GPAT, GATE. He has 20 years of academics, industrial, and administrative experiences. He is principal mentor for X-Pharm series software, as well as Patron member Indian Pharmaceutical Association, member Board of Management and Director Pharma Sciences JV Women's University Jaipur, Rajasthan. He is also mentor for Change NITI Aayog Government of India, ex-fellow Department of Planning Government of Rajasthan, ex-fellow MHRD Government of India. He has been recognized by various awards such as with various eminent personalities such as Health Minister Government of Rajasthan, Women and Child Development Minister Government of Rajasthan, and Mayor Jaipur, and many more degrees. Apart from this scientific achievements, Dr. Ahuja is a very good human being, researcher, and a social worker. So, with this brief introduction, sir, I would like to welcome you on the platform of ISF College of Pharmacy, and I would like to thank you from whole management that you have taken your precious time out of your busy schedule and on a very short span of time you have agreed to deliver to us. So, sir, over to you. You can start your session, sir, now.
Thank you, Dr. Saurabh Kose, sir. First of all, I would like to thank you to make it happen. And then, of course, I would like to thank the management of ISF College of Pharmacy, Moga, the chairman, Garg Saab, the principal, Dr. G.D. Gupta, sir, and all other dignitaries associated with ISF College of Pharmacy. And actually this will be a real platform to make students as well as pharma professional to understand how to use the virtual pharmacology experimentation software so that in their practice or in their research exposure they will have a confidence and insight for performing pharmacological experiments. So coming to the title, I'll share my PPT, and then after PPT, we will try to share the online virtual experimentation pattern also. So first I'm sharing the PPT, just 1 second. I hope it is visible, Dr. Saurabh sir.
Yes, sir. It is
Okay,
visible.
yeah. So before starting, as you can see, the animal is saying itself that no more experiments because they are also human beings. Like God has created us, similarly God has created animals also. So the animals are also now saying no more experiment, means the symbolical this presentation shows that the purpose of this seminar is to prevent the cruelty on animals. In the seminar, we will be covering following things. First, we will introduce what is virtual pharmacology, then how to prevent cruelty on animals, then virtual experimentation. What is virtual experimentation? What are the techniques? What are the software used? We will see detail about X-Pharm series software. We will see advantages of virtual pharmacology. So, introduction. Virtual pharmacology. What is virtual pharmacology? Virtual pharmacology is nothing but performing the experiment with the help of virtual tools like technology tools. So Uh, this is in single line we can say performing the pharmacology experiment with the help of virtual tools or technological tools or computers. If we talk about prevention of cruelty to animals, the act came in 1960. See, you can see in 1960, so it's quite old, more than 50 years old act it is. So in that act, it was written clearly that wherever it is possible, you can see the middle paragraph, wherever it is possible, film chart books we can use in alternative to animal cruelty or animal experimentation. So we can see in 1960, as we all know, softwares were not available. So in the act, it was mentioned like model, film, charts, books, etc. can be used. But as you know now, in today's scenario, IT has developed a lot. So softwares are available. So in adherence to Prevention to Cruelty to Animal Act, uh, the usage of software is being promoted. Virtual pharmacology experimentation is actually a nascent branch, we can say. Means it's not very much old, we can say it is around 18 or 20 years old when this all has started and this has taken shape, and uh, things are coming more faster nowadays in the virtual pharmacology field. So virtual pharmacology is performing the experiment with the help of computer application or IT application. Now there are two dimensions. If we see the techniques, so there are two dimensions. What in one is we can say software dimension, and another is we can say academic dimension. So as we are discussing here, and we am addressing to pharmacy students here. So basically we will be highlighting the pharmacy section or the medical section, how it means it can be applied, it can be used for pharmacological, for medical experiments. So if we see what is the experimental pharmacology series, it is nothing but a software, or we can say a tool which helps in performing experiment with the help of technology. Now there are number of experiments available in the software. These also experiments you must have seen if you are a pharmacy student or a MBBS medical student. You must have seen in your syllabus that these are the commonly used experiments, and the software also is covering all those uh, needed experiment in its we can say in its coverage, in its panel. It is covering all those experiments. uh, to enlist them, different drugs effect on rabbit eye, then tail flick apparatus, histamine chamber effect, rotor rod apparatus, ectophotometer experiment, hot plate apparatus experiment, ciliary motility experiment, plus mage experiment, pole climbing experiment, electroconvulsiometer experiment, dose response curve, bioassay, pupil control, Legendorf apparatus experiment, pyrogen test, then you can say dog PP and heart rate experiment, guinea pig in vivo in vitro experimentation, ileum, edema formation in rabbit skin, colonic motility, thyroid antithyroid drug effect, blood effect on blood sugar, then 2.3.4 point bioassays, then PD2 value estimation, PTZ conversions, diuretic activity, analgesic activity, anti-ulcer activity, stereotype activity, spasmogenic activity. And in addition to that, recently, to make it more understandable, we have added certain supportive tools for the students, which covers the different routes of administration, different route of administration. uh, you can see here different route of administration, blood withdrawal techniques, methods of anesthesia and euthanasia. Additionally, examination mode is also added in the panel. So it's a complete package which covers all the need of students. And as you know, MCI, now it's NMC also. Earlier it was MCI, now NMC also has, National Medical Commission also has made it compulsory. Similarly, Pharmacy Council of India has also made it compulsory. And if you will see the Pharmacy Council of India latest regulation, 2020 regulation, they have particularly mentioned X-Pharm software, the software which we are talking about. They have particularly mentioned in the syllabus X-Pharm software as a preferable software to perform the pharmacology experiments. So coming to next. Basically, see, you can see any
The
experiment on video
slides
also.
are not moving, sir. Slides are not moving.
Images are not moving.
The slides are not moving, sir. So
Slides are
please,
not moving. Okay.
so just
Now is
now,
it visible?
now it is visible, sir. Yes, yes,
Okay, so I'll just get a recap. I hope this first slide was there only at that moment, or
yes, yes,
next
sir.
slide was there.
First slide was there only, sir.
Okay, so just to take a review, what we have discussed, like I hope this is visible now.
Yes, sir.
Next slide is visible, Dr. Saurabh sir.
Yes, yes, sir. It is
Yeah.
moving.
So in the discussion, we were discussing like uh, what is the means what is prevention of cruelty to animal, then what is virtual pharmacology experimentation, then what are the different techniques, then what are the softwares used. So we have taken the overview first, then we saw the introduction. So in introduction, we understood, we tried to get the knowledge that what is virtual pharmacology experimentation. And as I told, virtual pharmacology is performing the experiment with the help of computer application. Then Prevention of Cruelty to Animal Act, so it came in 1960. And then at that moment also, 50 years ago, it was mentioned that alternatives should be used to perform the experimentation. And in the same sense, nowadays, because in 1960 softwares were not available, so it was mentioned like model film chart. But now as software is available, so it adheres to the Prevention to Cruelty on Animal Act also. Then if we see, we have seen like there are two major dimensions. One is software development, another is its application. But as a medical student, as a pharmacy student, we are in this session particularly, we are discussing about its application, its medical application, its pharmacological applications. So uh, here we are discussing X-Pharm series, which is the, we can say, the leading one software. Of course, we can say the number one software at present throughout the India, being used by all the AIMS, all the major medical colleges, all the major pharmacy colleges. It has reached to more than 3,000 colleges at present. So means this is the number of experiments being used through this software. So just to recap once again, we will see it covers different experiment on rabbit eye, tail flick, rotarod, ectophotometer, ciliary motility, convulsiometer, bioassay, 2.3.4 point bioassay, pyrogen testing, then edema formation, antithyroid effect, insulin analysis. Then we can say PTZ induced convulsion, breathing test, pylorus ligation, spasmogens effect. Additionally, recently it has covered anesthesia, euthanasia method, route of different drug administration. So means I have just once again reviewed all the things which were not visible in between. So what we can say is, it, through this software you can completely cover the pharmacology section of experimentation. And National Medical Commission has also recommended to avoid this cruelty on animals. Similarly, Pharmacy Council of India has notified different notification time to time. And at present, the latest notification, 2020 notification, has in fact specified the name of software also. The reason being, it covers all the modules which are needed for pharmacology experimentation. For whom the software? It is for medical, pharmacy, dental undergraduate students. How to get it? Simply you can go on Bureau for Health and Education website and you can get the software. Advantages of virtual pharmacology. Virtual pharmacology is basically provide benefit to avoid use of animals. See, by this, as in starting I told that like us, the animals are also creation of the God. So God has created us also. God has created human being. God has created plants. God has created animals. So it's necessary to uh, give a proper care to animal also. So in the same line, long effects from long duration, different efforts are being made by different agencies. So in the same direction, this software is very much useful in prevention of cruelty on animals. Secondly, number of experiment can be performed with this software in a very short time. Like with the software, uh, you can perform all the. Suppose you want to do bioassay. In normal case, you have to acclimatize the animal, 24-hour like light and dark cycle you have to give to the animal. Then you have to do the process. So it takes approx 2 to 3 days to you. But when you are talking in terms of software, same thing you can perform, same practical you can perform in 1 hour maximum. So this is the advantage. Secondly, the cost, the cost of maintaining animal is also very high for the laboratory in case of institution. So it is cost effective also, because at present the software is being provided by Health Education Bureau at a very economic uh, pricing, so that it can reach to maximum colleges, because the purpose is to prevent cruelty on the animals. And as PETA is also funding to our organization, so that's why it is being circulated and provided at a very economic pricing. Test reports, and see whatever reports you are creating with the software, you can save it. So you can say friendly to save the report, etc. Otherwise, when you are performing in your laboratory, you must be writing in your notebook or somewhere else. But here, all the reports you can save in Excel format or in screenshot format to your system also. So these are the advantages. So means in this PowerPoint presentation, basically we have tried what is prevention of cruelty to animal, what is virtual pharmacology, what is X-Pharm, what are the benefits of virtual pharmacology. See, when we understood all the things, I think we should practice some module also. So I'll try to share the screen of virtual experimentation panel. Uh, as far as this section is concerned, this is completed here. And now we will go on the second section of this presentation, which is actually performance of experiment virtually. So I am just sharing the screen of X-Pharm login page. We will just log into that panel and we will try to see some experiments. I am just logging in. Just 1 minute. Dr. Saurabh sir, now I am sharing the login page and we will be performing some experiments. Is this visible? Login page? Uh,
Yes.
Dr. Saurabh sir, is it visible?
Yes, yes, sir.
Okay.
Visible.
Okay. So now we will enter one sample ID and password here to log in the software. This is the login page from where you can log in into the X-Pharm software. You can simply find it through Google also to your system. Now, when we will log in into the software, we will see all the experiments here. You can see what I was discussing now. These are in front of you, and these all are in the form of we can say we can run it directly from here. So all those experiments which I was discussing. You can say rotarod, actophotometer, tail flick, elevated plus means complete syllabus of, you can say, B pharmacy, D pharmacy, even M.Pharm certain module, even PharmD. See, in certain PhD level performance, or in certain M.Pharm experimentation, even PCI is saying that you can do animal experimentation. But at UG level and it's in certain PG experiments, in diploma level, in PharmD level, you have to have the virtual software, which is means this XFarm is also one virtual software, and you can use it. So in fact, this one is the recommended by PCI. So because it is covering all the modules, so it will be easier and useful and helpful for you to use this one. Now it contains the supporting resources, you can see at the bottom, like route of administration, blood withdrawal technique, anesthesia. Additionally, at the bottom, examination mode button is there, where you can see the unknown sample effect, etc. Now, like in the on the day of exam, you used to give unknown sample to the student, and likewise you can perform. Just 1 minute. So now we will see, for example, we will see few modules. So I am opening the experiment of different drugs on effect of different drug on frog herd. So this is the panel of the experiment effect of different drugs on frog herd. So in this one, you will select the drug. See, you have complete instruction section, quiz section, observation table section, result section, etc. So in this one, we will simply select the drug. Suppose I am selecting epinephrine here. We will inject the drug. So you can see we have seen the response, and earlier the basal heart rate, which was 65, now it has increased to 75. So we have seen like effect of epinephrine, that it increased the heart rate and increased the power of contraction. Suppose we want to see the effect of another drug, we will select another drug. Suppose I am selecting isoprenaline. So now you can see the effect of isoprenaline here. The basal heart rate, which was 66, has increased to 91, and also power of contraction has also increased. Can do washout. So number of effect we can see. Suppose we want to see the effect of potassium chloride, we will inject it here. See, this is the response of potassium chloride. So earlier the basal heart rate was 66, but now it has reduced after injection of potassium chloride. It has reduced to 1, whereas power also decreased. We can simply wash out. Now we can see effect of, suppose we want to see effect of propranolol, which is a beta blocker. I have clicked inject. See, the basal heart rate, which was 67, has reduced to 48. So you can see uh, like propranolol effect or multiple drug effect you are able to see, and the dose is getting adjusted automatically. See, we are at present we are seeing this module in the tutorial panel. now the latest version, as we are using the latest version of software, we will see this complete module again in exam mode panel. So I'll click here. Now we will see the same experiment in exam mode. I will click here. At the bottom, this exam mode button is there. I have clicked it here. See, all the experiments are there in exam mode also. Suppose now we want to see that frog heart experiment. I am clicking here. Now we will see the same experiment in examination mode. See, now what has happened? You are not having instruction in front of you. You have to perform it yourself. And now different sample drugs are mentioned here. Now drug name is not visible. So on the day of exam, the faculty may ask to identify the sample drug 4, sample drug 5, sample drug 6. Suppose now now drug name is not visible. So we will select the drug, we will inject the drug. See, now you have to tell that which one is this one, sample drug 1. Anyone you can select. For instance, I have selected sample drug 1. So now the student have to tell, like, when the heart rate has increased from 65 to 75, which drug it could be, or the student can give idea like what drug it could be. So this is the newer version of software which contains unknown sample examination, or it gives more insight to the student, like to identify. In the previous section, complete introduction and everything was there, and then the student was performing the experiment. But here the student have to identify the unknown drug also. Now we are coming back to the main section, tutorial section. See, this was the graphical experiment. One more, we will see the normal, we can say this behavioral model. Just 1 minute. Rotarod experiment we are seeing now. So see, this is the Rotarod experiment panel. You can see complete instructions, equipment detail, principle detail, introduction part. So in this one, basically what happens, there is one, you can say one equipment is there where we used to put the animals on the rotating rod, and we used to check out the falling time of the animals, and by which we identify the muscle strength. So usually it is used to check the muscle relaxant drugs activity. So in the top you can see effect of CNS suppressant and skeletal muscle relaxant drugs on mice using Rotarod apparatus. There can be mice also, there can be rat also. So these are the one more thing in this software, the instructions are quite simple. It is not like theoretical things are written, like one page matter is written, everyone is studying. Here very simple 5 steps are written: click the animal, pick the animal, inject the drug, like that, so that student will be also having interest in performing the experiment. So first of all, we will administer the drug to the animal. Now we will see the effect of. See, there are two groups. One is vehicle treated, another is drug treated. Suppose we want to see the falling time of vehicle treated animals, so I have clicked it here. Now you can see this vehicle treated animals. We will see the falling time of animals here. See, all the animals are kept on the rotating rod, and now we will see the time, in how much time they are falling, which will reflect their muscle strength. See, all three animals are trying to save themselves from falling on the bottom. So they are applying their muscle strength. Now we will see the time at which they will fall down. See, the middle one has fallen down at 50. You can see the timer has stopped automatically. See, the right one has fallen down, the timer has stopped. The left one has fallen down, the timer has stopped. So whatever time we have seen, we will mention it here. Suppose 52, 50, and 55. Free riding was the number of time they rotated completely. So it was like 1, 1, 1. Now, similarly, we will check for the same response for drug treated animal. Now we have clicked on drug treated animals. Now we will once again see the falling time. Free riding is nothing but this. See, this one has completely rotated around the this one. No, that is free riding. See, middle one has fallen down at 39. Left one has fallen down at 45. This one has fallen down at 43. Free riding is just one additional parameter. Main parameter is fall off time. So we have seen for both the groups the falling time. Suppose free riding, we can write it here. So now basically the main factor is fall of time, which is the important. So the fall of time, you can see the fall of time when we have given the drug, the fall of time has reduced. See, whatever we are entering here, now we will click on this observation button, we will be able to see that is visible in front of us. Okay, so whatever we have mentioned there, you can see we mentioned 52, 50, 55, 42, 39, 35. So complete data has fetched here and complete results are there. Complete calculation has taken place, and so that the conclusion has also came that the observed reduction in fall of time and free riding shows that diazepam 1 mg per kg IP dose produces decrease in motor coordination and decrease in muscle strength. So here we have seen that the diazepam is reducing the muscle strength, so the falling time has reduced. So they are unable to grip the rod for longer time. So this is how you understood the complete experiment with a complete actual practice and actual. You have not only seen the things, you yourself have entered the data. Means it is, I can say this is the only software which is providing you this opportunity to enter data from yourself. Even now, similarly, when we will go in the examination mode of this experiment, you yourself have to once again see the falling time. You yourself have to identify the drug. So it is not like a video, or it is not like a fixed software, fixed reading software. It is open-ended software where you will enter your data, you will fetch your data. So now suppose I was performing this experiment, so I have written free riding 1-0. So someone who is visualizing the experiment may write 2-1-1-3 something else. So it is not fixed result will come. Result will, so every student will apply its insight and every student will perform the experiment with his or her uh, mind application. So they will understand the basic concept and everything. So this was one experiment which I have shown, Rota Road experiment. Before that I have shown the uh, what was this frog heart experiment. Similarly, number of experiments like tail flick experiment, breathing test, PTZ induced convulsion, number of experiments, and in addition to that, see different method of anesthesia, different method of blood withdrawal, different route of administration. These are also being added. So by which student will get insight like what are the different method of anesthesia, euthanasia. Suppose I am clicking on this one. So supportive resources are also there. These supportive resources will actually help the students in understanding like what are the different methods of anesthesia, what are like what they are performing in virtual section, they are giving exam, but they should have, first of all, they should have basic idea also. So complete idea, see, complete idea is also written in the software itself. See, these are the CPCSA guideline. This is the commonly used method of anesthesia. Euthanasia is also described here. See, complete and most importantly, this is from the CPCSA website. As you know, it is as you know now CPCSA has been converted to CCSA. So, but CPCSA earlier it was known as CPCSA. So this is the authentic data from CPCSA. Now suppose we are performing the practical. See different anesthesia method, euthanasia method. Suppose I am clicking on inhalation method of anesthesia. So first theory will be there, then video will be there. See, this is the inhalation anesthesia. What we used to do, we used to put one cotton with the anesthetic near to the animal, and we used to see the anesthetic effect of the anesthetic on the rodent. Either it can be rat, mice. For performing practice, we have added another section also. So this is just to give one insight. Practice section is also there. So you can see the animal has gone to anesthesia. So this is basically these supportive resources are just to give you one idea about what are the different method of route of drug administration, anesthesia. But these above experiments are the performable experiments, and examination mode is for the day of exam when your teacher or your examiner can give you unknown drug and you have to identify like which drug it is and all. So we can see this is quite a comprehensive type of software which covers all the things, and in fact if we see uh, the contribution is from different medical colleges, different pharmacy colleges, and I would like to thank ISF College of Pharmacy Moga that they have also supported us and they are using the software. Additionally, if we talk about all the aims like aims Mangalgiri, aims Bhatinda, aims Jodhpur, all in India, we can say aims is considered as in medical science, aims is considered as a gold standard. In addition, this pharmacy colleges like uh, your college itself, ISF Moga, then Jamia Hamdard, then we can say BHU, Banaras Hindu University, all like BITS Pilani, BITS Ranchi. So means all the top-notch institutions which are performing B.Pharm course mainly, uh, they have completely acclimatized this software and they are thoroughly using this software. And additionally, coming to this pharmacology research part, when you are isolating any drug from a plant source, then I will suggest you that then you need to perform animal experiment only, because in that case when you are isolating any salt from plant source or you are extracting any drug from plant source, in that case you need to perform the experiment on animal. In that case you are going research, as you are doing your research part, you have to do it on animal. But in D-Pharm experimentation, in D-Pharm experimentation, in certain M.Pharm experimentation, in Pharm D experimentation, this will cover your need and this will give you an insight. And while the PPT presentation, I also told like at present you perform two experiment in just 30 minutes, and whenever if you want to do in your laboratory, you need 3 days to perform these two experiments. So this is the beauty of the software. You can save your data. This is another advantage. You can the the money is also saved in terms of otherwise animal preservance of animal, then fooding of animal, everything requires a money also. And above all, the most important purpose of the software is to prevent the cruelty on animals. So with the help of this software, we are able to save the lives of animals, number of animals life we can save. So what I was trying to say, like this latest version of X-Farm software, in addition to experiments, it also contains number of examination module, number of supporting resources. So I can say, to prevent the cruelty of animal, this software and virtual alternatives should be used a lot. So this was the presentation of software part. I have shown few sample modules. It is a quite comprehensive. It contains 35 group modules. It means around 100 experiment at present this software is covering. So I have shown one or two some sample modules to you. Now I am stopping the sharing here, and coming to our discussion part. The purpose, I would say that by this software, if we can save if we can save the cruelty on animals, so that our purpose will be resolved. Like if we can save at least 100 rat, and although we have saved life of 1,000 rats, 1,000 of mice, as I have told, at present also around 3,500 colleges are using the software, which is a big number. And all the pharmacy colleges, all the medical colleges. So we can say we have saved the life of lakhs of rats, lakhs of mice, lakhs of guinea pigs. But with this particular virtual presentation, if we can save another 100 rabbits, another 100 mice, another 100 guinea pigs, then the purpose of this virtual session will be solved. So this was from my side, and at the end, I would say that save animals, save trees, and save the earth also, because these all are in a balance. Are human beings, animals, plants. God has created a balance among them, and as we have recently passed through a major pandemic called COVID, through that, I think everyone should understand that the nature balance is also important. So I will once again say, save animals, save earth. Thank you.
Thank you, sir. Really an insightful talk from you, sir.
Yes,
And I have seen you on various platforms, sir, recently at Kanpur also. And this is one of the need of the hour in preclinical studies. So beautifully, wonderfully, sir, you have told about this. This is one of the, I would say, in 21st century in India, one of the thing you have developed, and really it is beneficial to the higher center of excellence of study in medical and pharmaceutical sciences. So, sir, on behalf of ISF College of Pharmacy Internal Quality Assurance Cell, in this dialogue series, you have taken your time to deliver us this wonderful talk. So, once again, sir, on behalf of entire management, I'm thankful to you. And definitely, this talk will be beneficial to the students looking further in future to study medical and applied pharmacology. Thank you so much, sir, for your time and session.
thank you, Saurabh Processor, and the management of ISF College of Pharmacy, Moga, for the invitation and organizing this insightful talk. Thank you.
Thank you so much, sir. Thank you, sir.